Okay, so it is Saturday morning, and I actually overslept a little bit today, so we're a few minutes behind. Um, I'm trying out different angles because apparently the cereal boxes I was using um, to block out my client names on binders were annoying. So I've diversified angles, and I'm trying different spaces within the home. So it has been a crazy week. I'm happy to update you. If you have any questions, please put them in the live chat. It takes anywhere between 30 seconds and a couple of minutes for them to show up. So you may see a little bit of lag. I have another couple of events with the bandana. The staples are coming out next week, so they should be gone. It's this and town hall, and then no more bandanas, which is lovely. So this week has been hard. We just had Florida hit almost 10,000 cases of COVID-19 in one day. That's more than the state of Maine has had by several factors. And several other states are sort of in the same space. So I would guess that it's not going away anytime soon. I would advise anybody that you know who isn't wearing a mask to please wear a mask. It is the kindest, easiest, most conscientious thing you can do to protect yourself and your neighbors and your family. And also start preparing for there not to be fall as what we're used, or school is what we're used to in the fall, because it is unrealistic at this point in time on the trajectory that we are at that we would have functional full-time in-person school, particularly elementary schools. Children just cannot functionally socially distance, and it's annoying for adults to try and keep a mask on for all day. Really hard to get kids to keep a mask on all day. We also discovered that despite pushing Russia to be back into the big league, um, our executive branch has known for several months that Russia has had a bounty out on U.S. soldiers, which is just not unexpected, but still horrifying to read. That should anybody who thinks that our executive branch is still interested in protecting our military obviously has been paying attention. So that's really unfortunate because our veterans and our soldiers put in their lives and their whole families' lives and whole ecosystems on the line to be able to keep us safe and protected. And our executive branch sees them as disposable mercenaries. And that's just, um, it's heartbreaking to me as somebody, I have not served in the military, but my father was in the Navy. My mother's father was in the Navy. My mother's brother, my uncle, was in the Navy. So it is heartbreaking to me to see service members be treated just with such little regard and with so much callousness towards what they sacrificed to be there for us. So that was something that I found to be really unsettling. Between that and the callousness that we're all being treated with COVID-19, it is terrifying where we're going. We are definitely on a beeline into fascism, and we also had a ruling, or not a ruling, a filing in a Supreme Court case this week where our government basically said, let's just rip out the ACA. And I'm obviously very much paraphrasing, but let's rip out the ACA. And anybody who voted for the tax plan really voted against the whole ACA in when they voted for the Tax Cuts and Jobs Act. And I mean, I guess that's sort of objectively true that they did vote to undermine the ACA. I am most certainly not a fan of the ACA. I think it provides a very large segment of our population with insurance they can't afford to use and they can barely afford to buy. But that doesn't mean that the solution in the middle of a pandemic is to just make it go away without anything to replace it. I think that we need to get people functional health care. And I think a lot of people want to say insurance for everyone. I get beat up a lot because I don't like Medicare for all. I think Medicare for all only fixes some of the problems. I think that we have much bigger problems than that. Medicare for all fixes some of the patient problems, but it doesn't fix a lot of the supply side problems, and it's still fundamentally insurance. I think we need healthcare. So we don't have that. We don't have any real plans, at least on the Republican side, to get it. On the Democrat side, there's a little bit of a tussle between Medicare for All and some alternative. I would like to see us look at a few models and make sure we're getting a really good comprehensive system, because what I don't want is to really disrupt our system with something that, is slightly better, or, maybe works better, and end up having it be poorly implemented and a mechanism that just drains the trust that we have for Medicare, and ends up with us having no doctors in rural areas, and there's a lot of tweaks. So, I can't say that I'm a huge support of Medicare for All, although I certainly can say there's some interesting pieces to it. I think there's some premises to it that are helpful and probably should be included in a larger, more comprehensive solution. But I think that we create some massive supply side with that. And I think we should really be looking at that right now. I mean, this is a pandemic. We have botched it so badly. It's not going away in the near future. It certainly is not just going to disappear on its own without ripping through the population. It is quite the tragedy that we have created for ourselves, with no functional healthcare and a pandemic that we just utterly mismanaged. And I mean, even if you look at some of my feedback over the past few months over it, it's changed a little bit, because what we knew about the disease itself has changed somewhat. So, or the virus itself has changed. So, we are trying to hit a moving target. We are finding out new things about it all the time. And it would be a lot easier to adapt if we had the supports that we needed and the supply chain that we needed, and we could move things around more easily. And we had a population that was being led with leadership. I mean, how a mask that is a basic safety tool got politicized is just unbelievable to me. I mean, yes, at the beginning we were saying, please don't go buy masks, because we didn't want to deplete N95s. And I said that too. Please don't go buy N95 masks. Medical providers need those. Our stocks are low. We did not plan appropriately. We are not in a good space, and those need to go to first responders and medical providers and emergency workers. But the cloth masks ramped up very quickly. Everybody changed tone on it, at least at the beginning, very quickly. But, the executive branch couldn't stay stuck on it for more than 3 minutes, because it's annoying. Yeah, of course it's annoying, but it is substantially less annoying than killing your neighbors. So I worry that we don't have functional healthcare. I worry that we can't talk about healthcare. And I worry that I can't talk about that sometimes with either side. I have objectively different responses from either side. Republicans often will tell me they want to go back to what they had. Yeah, I had great health coverage in the 90s. My copays were $5, but that's just not the system we live in anymore. Nothing we can do can bring that system back, because it was a different time period with different factors, different risks, different coverages, different costs, different technologies. That system isn't coming back. It was great when I was a very close to minimum wage worker and I had that kind of health coverage, and it didn't cost me anything except for a periodic copay. My frustration, a lot of times talking to people who tend to fall into the Democrat category, talking for Medicare for All, there is a very aggressive, very assertive, it's my way or the highway, which is very frustrating to me, especially when it comes to people that I know personally. I understand they're passionately committed to the cause, but there are improvements that need to be made on that bill, and that methodology before it moves forward. It just has to be, it has to be something that's health care, not health insurance. Health insurance is problematic. It has a lot of the denials. It has a lot of supply side problems. There are huge opportunities for fraud, and there are huge opportunities for abuse from the single payer. Might it be progress? Yes. But let's talk about it, and let's really model it before we transition it all out, because what we've got needs to be modeled anyway. So that has been some of my frustration this week. Other things that we saw happen this week, excuse me, I have an alert that is going off. So this week I'm trying to think back. It's been one heck of a week. Oh, I have a lawsuit that is going, and Steve Collins from the Sun Journal broke something that I wasn't going to tell you guys until Monday when I got my new filings in. But both other independents in the Maine Senate race have sent in affidavits of support for having me on the ballot, which is awesome. It's something that I really like about ranked choice voting is we can support each other and be kind to each other. And in fact, it is beneficial to be kind to each other. So with ranked choice voting, I put up periodically little videos. If you don't know how it works, there's a ton of videos available on YouTube. But with ranked choice voting, it is not only encouraged to be kind to other candidates. There's no reason to be backbiting and awful. You certainly want to correct people if you feel like they're giving misinformation, but you don't have to make the other candidates look appalling. But you also were trying to reach for their number two. So you saw two people who were very ideologically different gave support of an affidavit. So Max Lynn is very excited about our executive branch. He really likes Donald Trump. And ideologically, we have some pretty substantial gaps. Lisa Savage is a Green, and she is certainly has more in common with me on a lot of policy issues than Max Lynn, but also some pretty big gaps in how we feel about a lot of things. And both of them were able to come together and say, hey, we think that ballot access is really important. We've seen a lot of ballot access and voting access issues pop up. And it's important to note that it isn't just Republicans that are doing it. When I sued 4 Democrats to get ballot access. They failed to protect the health and safety of candidates. I have multiple candidates that I've talked to that dropped out of the race because they didn't feel safe. They couldn't get signatures. So it is power that has a problem with new systems, and is power that doesn't want to let go. It might let go in different ways, and it might have different ways that there's suppression, but suppression on the ballot is an issue. And it's an issue we face across the country. It is really it is really impactful to see lines of hours of people waiting to vote, and that should not happen in the United States. That is a huge impact, but it is also really a huge impact if we don't have the choices we want on the ballot. That is something that is really important. And so a lot of what I fight for in my candidacy is making sure the system's not broken. And it's the same sort of stance I have with medical coverage. We need to make sure we have systems that work. We need to make sure we have systems that are accessible for the average person. I'm going to chat for a few more minutes. I see some more people have jumped on. If you are interested in asking questions, you can type them in the live chat. I'm happy to answer almost any question. I don't think anybody's asked me a question I felt uncomfortable with so far, but almost any question I will answer. So we need to be really making sure our systems work and our systems are accessible, and our systems are accessible for all of us. They need to be accessible if we're a minority or if we need a little bit of help and we have disabilities or challenges. They need to be accessible if you're rural and in the middle of nowhere. They need to be accessible if you're in a city. They need to be accessible for things like, when we saw COVID hit Manhattan, it was hard because they actually have decent infrastructure compared to a lot of places, and they actually have public transportation, but that public transportation suddenly could become dangerous because everybody's in a very small space together. So we need to have systems that work for a wide range of people in a wide range of situations, and we need to have better backup plans. This certainly doesn't apply to just parents. But when you're a parent, you make sure in your bag you've got granola bars and you've got wipes and you've got all the things that you need, even if you'll never need them. And sometimes that means you carry around a little bit bigger bag, but that's what it takes to make sure that you're prepared for all situations. So we need to have a lot better supports for our citizens and a lot better supports for our systems. So that's kind of what really struck me this week. I feel like I'm babbling a little bit because I've had no caffeine. I overslept and I ran downstairs and turned on the camera for you. It doesn't look like we have any questions, so I will probably call it a pretty short morning, and I'm sure I will be properly caffeinated on Tuesday. I will see everybody online, and I will see you for Town Hall on Tuesday.